Good morning to everybody. Everyone from us metabolizes different. We know that already since the 60s, when Professor Vogel in Heidelberg discovered that. That was the origin of pharmacogenetic. Only in 2021, we discover, or we can say that the full genome from persons was complete clear, and then we have not thousands of genes, but we have just 19,969 genes. And the very fast advance of the molecular technology makes this possible that we look into them. That means those are the preconditions for being able to look in the genes of every one of us and decide how is it possible that this person will metabolize their medication. And the time is coming, and it is now. I want to share with you some of the experiences we have on this area since 10 years in a small town in Bavaria in Germany. The first question is, what are we talking about? When you look at the literature, everybody is talking personalized medicine, precision medicine, individualized medicine. What is the real thing? I think it's just a matter of name. What we are really talking about is how to tailor a medical treatment to the individual characteristics of each patient. We're talking about translating this meaning of these genes, which each one of us have, into the right information, which is evidence-based and which is actionable for a doctor in order to make possible for him to give the right treatment to the persons. Right now, there are many different approaches. You see that in the drug development, you see that also in the analysis of somatic variants in the cancer therapy. Those are things which are going very well. But we see also some other things like nutrigenomics, where there are many, many, many apps, and they are giving no results. Also, the epigenomics is there, very interesting, but just beginning in the real research. What we decide is we will approach this complexity with a strategy which says for us, take the most easy of all those things and approach it. It will be much, much more complex as you think. Our inspiration comes from the very well-known article from Mr. Howard and his colleagues in 2015. He said in the development of this personalized medication, there will be two periods of time. One time is this incumbent curve, which he calls, where we are going to collect a lot of data in each different areas of the medicine which are coming. And there will come a point in the time where we say all this information can be integrated. All this information can be understood, and that will be the moment when we can talk about personalized medication, precision medicine. And that based on a knowledge network which until now was separated and is still developing on the time, a knowledge about genomics, knowledge about the microbiome, knowledge about exposures, behaviors, the clinical tests, and of course the information from each person. Man, woman, age, weight, the clinical values, what we eat, which are our pleasures, what we are doing, all that is the base of everything. And so it would be possible to put all that together and be able, I don't know if it's possible to say yes, to be able for this one single person to give the right medication and in a fast and reliable way. It is the game changer for prescription. We choose that because, very simple, the number of recognized mutations, variations in the genes where there is a lot of evidence already available and where is also a lot of actionable information is the pharmacogenetic. And we took that as a first step, and we have been doing that and implementing that with doctors in Germany. And the very simple thing is that the doctor have very fast the possibility to decide, is that the right drug? And if it is the right drug for this patient, what is the right doses for them? And that combined with everything else what they have, and that makes easy everything. And what we also recognize, and working with the doctors themselves, they told us, okay, pharmacogenetics is wonderful, but when I look at the patient, I cannot see with my eyes which are the genes they have. I cannot see how it works. And what we have seen is that it's necessary to have a comprehensive system with everything which is needed. We need the pharmacogenetics, we need to consider the allergies, we need the personal data, the lab values, the drug interactions, which looks very similar, drug-drug, drug-food, drug-gene. All of them have the same symptoms, and the doctor cannot differentiate between them. We help them in that there. Of course, the lifestyle, and this is just the beginning. What is coming is the radiogenomics, very important in case of cancer patients, the microbiomics, the nutrigenomics, all those things. And then we need that as a medical device. The regulatory that was very well addressed from a speaker before is a very important factor. The doctors, they are responsible for the prescription of the medicine, and they need to rely on those systems. They need to know that this system is giving me a good information I can apply in the very short time I have to make a prescription. These challenges to bring the pharmacogenetics is what we have been doing the last 5 years. The most important thing for us was the clinical workflow. In each country, you will find a different workflow. In each hospital, you will find a different workflow. And if you try to change that workflow, you can be sure you are not going to be successful. You have to observe very careful what they are doing, to involve the people, and to see how you can make their lives easier and preciser. That has to do with the physician's acceptance, and that has to do with listening to the doctors. What they say, what do they need, how they get they make their process. We had a patient with 13 is normal, patients over 65 years, with 13 drugs every day. When they come into the hospital, the doctors need up to 45 minutes to see where is my patient, what is he taking, how is it, and still after 45 minutes they make an approximation. With our system, they are needing now 13 minutes, and that is money for the hospital. And this is rely for the patient and for the doctor. That is security, safety. That is what they are achieving. And of course, the physician is accepting the system. The most nice thing we receive are the compliments from them. They say, I like to work with it. It is so easy. I don't worry. It is like my insurance. A doctor told me, this is my insurance. I know I can rely on that. In order to offer that, and if you are dealing with genetics, but also with pharmacology, it's very important that the information you have there is state of the art. And it's also important that you are doing a right interpretation. It seems easy, but there are many people working all around on pharmacogenetics, but the way the interpretation is done is quite different. If you compare the different organizations in the USA, Europe, and Japan, where they are putting together, they are overlapping only on 33% of the information. What we have done, we are curating per hand all the information, 16 years, and we are smoothing everything. We belong to all this organization, given our contribution, and we are getting something which is actionable, evidence-based, and standardized. And of course, for a healthcare system, it is a horror to think that they are going to have to pharmacogenetic all the people, the cost will be too high. It is not necessary to do it. We have developed a stratification method, and with it is easy that everyone has a personalized medication, but it is also easy that the costs are not going too high. I'm very proud to be today here in Spain. Spain is the leader worldwide in the introduction of pharmacogenetic. Since the 18th of July 2023, there is a law which says that if a person who lives in Spain needs a pharmacogenetic test, they have the right for it. And that means it is the realization of the personalized medication and leading all the world to bring to that, to a cost which is available to everybody, and that fulfill this dream we have at our company with our 49 employees. We were participating in this first project in the state of Extremadura, and then Project Medea, together with Illumina, we implement a personalized medication for Spain. We have now 26 hospitals in Germany, and so I would like to share this experience. I'm very happy. That was my dream. That's why I began with this company, to allow everybody, not only the rich people, not only the ones who can pay 8,000 euros for a pharmacogenetic test, but everyone who needs that to have the right medication. And that is what we are doing now. Now, next. That I will escape because we don't have time. But I think today a doctor will not make a prescription if he doesn't have the blood count of the patient. And I believe that it is also very important that the doctor has the genetics patient information, so that we all, in case we get ill, and most probably we will get ill with the age, that we get the medication which help us to do. Thank you very much.